RAELYNN is not embarrassed about this, and
Right.
because it doesn't embarrass RAELYNN, it's good if someone wants to, know about this.
I'm going to let her sleep a little more before doing shaker vest. She hasn't been sleeping the best. In fact, we're going to do a sleep study. We are doing...
Sleep log. That's not a sleep study. Right?
We're doing a sleep log. Didn't you say that she was going to do a sleep study?
A sleep study is when you go to the hospital and you're hooked up to 50,000 sensors.
Okay. So we're doing a sleep log, recording when she's sleeping and what's going on at the time that we notice her sleeping or not sleeping.
Sleep study is scheduled for when she fully recovers from hip surgery.
That's what I meant. I meant to say that, is that we're going to do a sleep study. I think that's what I said even.
Sorry.
It's okay.
You can go listen to it and see.
We're going to do a sleep study. But anyway, so we're hopefully going to figure out why she's not sleeping the best. And we noticed last night that she didn't sleep the best. So we're having kind of a lazy morning, letting her kind of sleep in just a little bit more right now.
What if the world had more of your smile? What if the wind could spread your love? What if your sweetness could reach everyone? There'd be no wars.
So I'm definitely starting to get hair growing in places that I don't necessarily want it just yet. Not quite ready to embrace the old man ear hair just yet. Oh, so this is interesting. Our shower is gone right now. I tore that up. We're actually going to get a new shower sometime in the next few months, hopefully. We're actually going to redo this whole bathroom. It's tiny. This is a tiny, tiny bathroom. So we're going to have this redone, and it's going to be a while. We finally picked out the stuff that we want, and they ordered it. But once they get the materials in, they still have to schedule when they're going to do it, and it's going to take time and all that stuff. So eventually, we'll have a new bathroom. That'll be nice. So Abby and I have actually been using RAELYNN'S shower for our primary shower. Which is nice because it's a nice big shower, and our new shower won't be as big as her shower is because it's huge, but it will be nice having our own shower off of our bedroom again, so that'll be good. Okay, RAELYNN, we can't sleep all day. Let's wake up and do some stuff, okay?
Maybe the birds will sing about your heart. Maybe the trees will whisper the word.
Are you waking up now, RAELYNN?
Maybe the sun will spread your joy to the ones who lost their hope.
Are you waking up with a smile? It's not so bad, is it, RAELYNN? It's not so bad. She used to not like the cough assist at all, but she's finally gotten used to it, I think. I wouldn't say she necessarily likes it, but she doesn't give us mean looks like she used to.
Fill my head with roses. I can't help but dream away. Standing on a field with you and flowers everywhere.
How's that? You ready to go for a walk? Mm-hmm.
Are you smiling now? You're not crying no more.
That's good. She's been kind of happy.
Wanna go for a walk?
Yeah.
Let's go.
Let's go for a walk.
Maybe there is a star with your name. One thing I know is that there should be. There is no one who has a heart as pure. No, not like yours.
What's Mom got, RAELYNN? What is it? Is that a corn leaf?
From the cornfield.
What you think?
Crunchy. It's crunchy.
What you think? You like it? Is that funny?
She grows a lot of earwax.
Mom's cleaning her earwax out. All right, we want to talk about what Abby learned Thursday about RAELYNN that we'll need to address. So RAELYNN has a blockage in her vagina, and it's probably or certainly the uterine lining. RAELYNN is on an estrogen patch that's caused her to start puberty early, and a lot of kids like RAELYNN do this for various reasons. Growth attenuation, meaning we want her to stay fairly small. And I know that's controversial, but as her caregivers, that will help her to have better care.
It's easier to find people who will care for her, too,
Yeah.
like nurses that say, yes, I can help you take care of her.
But as I understand it, that's not even primarily the main reason she's on it. She's on it to strengthen her bones and keep her bones from growing, which means growth attenuation. But also it means that, like, when she had spine surgery, her bones not growing is important because she has a spinal fusion.
You can't get a spinal fusion until you're almost done growing.
Which meant pushing her through puberty early so that her bones are done growing. So RAELYNN probably won't get much bigger than what she is, and that's okay. That means that we can lift her and take care of her.
You like being fun size, huh?
She's fun size. So they think that it's probably her uterine lining that's out of place, or just not. How does that work exactly?
It's not able to escape.
Her uterine lining is not able to escape.
And they don't know why. They want to do an MRI, and they said that, and I said, well, she has metal all up and down her spine. They were like, oh. And I said, and she has a VNS in her. And like, okay. I'm not sure what we need to do, but she needs to go see a gynecologist. And then she also needs to see a nephrologist. I might be saying that wrong. Kidney doctor. Because she had calcium deposits they saw when they were doing an ultrasound of her pelvic parts. So Wednesday we should learn what that is. I think it's scar tissue. I think it's scar tissue just because she's very difficult to cath. And there was one instance in particular in the hospital that I know caused some scar tissue. And then I think when she grows and has growth spurts, sometimes that scar tissue is grown. That's what I think it is, but I don't know.
Now, some people think that cathing is also controversial. I've gotten some comments that say just let her pee on her own. And I mean, I understand why people would say that.
16 hours without peeing, that's really painful and
So,
not good for your bladder.
RAELYNN sometimes goes all day without peeing.
If we don't help her.
If we don't help her, if we don't cath her. And we don't cath her every day. We probably don't cath her. There's some weeks that we go by that without having to cath her.
It depends on her seizures and her meds some. Because if she's taking a lot of pain meds, she needs cathed a lot more. Her bladder doesn't work if she's on a lot of pain meds.
Yeah. If you don't pee, and RAELYNN's on a 24/7 feed, so she's getting fluids all the time. If she didn't pee those out, her bladder could literally rupture. So it's important that we empty it when it's full.
She wants it empty.
Right.
Like, she gets uncomfortable. Yeah.
So I just wanted to address that real quick, because I know I've gotten a few comments about that seems cruel to people that we would cath her, but it's actually helping her.
Lots of people have to cath themselves regularly. That's not something, people don't talk about it, but it's not that unheard of for someone to have to self-cath. And I think most people say, like, you get used to it. It bothers some people more than other people. It doesn't seem like it bothers RAELYNN extremely. I mean, I wouldn't say it's not 100% comfortable, but compared to an overly full bladder, I think she would prefer it. It's not horrible.
Yeah. So, as far as finding out what's going on with RAELYNN's
Girl issues. Did you laugh at that? That was good timing for that smile. That was good timing.
We'll find out more this coming week, what they recommend that we do, but they'll probably need to go in through her vagina to.
Oh, I have no idea.
To clear it.
I have no idea. I do want to say, I'm thinking you're going to get people commenting saying, why are you talking about such a personal, private matter about RAELYNN?
Yeah.
And RAELYNN is not embarrassed about this at all.
Right. She
doesn't have that cultural knowledge. That's a cultural thing, why we're embarrassed to talk about things like that. It shouldn't be embarrassing, but our culture makes it embarrassing.
Yeah.
She's not embarrassed. I would not talk about this about one of my other children because I wouldn't want to say something that embarrasses them.
Right.
But it's not because it's wrong to talk about it. And because it doesn't embarrass RAELYNN, I think it's good if someone wants to, know about this.
Yeah, I mean, part of the reason we have this channel at all is to help people who are going through similar things. And if nobody's talking about it, then they don't know
Yeah.
how to navigate those things. So I don't know if any of our subscribers or people watching this have had to deal with this kind of thing before. And if you have, leave a comment about it.
If you want to.
If you want to. I'm not trying to out you.
If you don't. But, like, we should respect people's privacy. We
Yeah.
should respect people's desire to keep something private.
Sure.
But if they don't have that desire to keep it private, which RAELYNN doesn't, and it can help to tell other people, then we think that's fine.
Yeah.
So RAELYNN'S not embarrassed for you to hear about her problems if it maybe helps you in some way.
Right. Now, there was other news, too. I didn't talk about this other one, but you said that there, in addition to that issue, there was also something else that you learned last week.
You mean her kidneys or
Yeah.
the sleep? Yeah, her kidneys have calcium deposits. I don't know if they mean kidney stones or if that means something else. When she was like 3, they said there was highlighting on her kidneys. I think I tried to Google that and I didn't see that phrase, and I thought maybe I misheard it. But like back when she was 3, she had what I thought they said was highlighting on her kidneys, which was, I think, the same thing, like calcium. And I remember saying, do we need to follow up with this? And they always said no.
Yeah.
But I think it's a progression of maybe whatever started then. And I'm wondering, like, how many of her meds are just hard on her kidneys.
Have they said what they think we can do about that?
No, they just literally sent me a My Chart message, I think Friday or Thursday evening, and said, hey, in addition to going to see the gynecologist, she also needs to see I think they said nephrologist, and then they put in parentheses kidney doctor. I'm saying it wrong.
So she'll need to see more doctors. RAELYNN, you get to see more doctors.
I don't know if they'll do more ultrasounds, but she thought that room was fun.
Did you like the ultrasound?
They asked when they called me as we were leaving the hospital, and that didn't surprise me. Like, so they're doing the ultrasound, they do it, they're pushing around, they're like, okay, stay right there, we're gonna see if that's what they need, and then we'll be back. They do say that a lot. They say that after x-rays, like, wait, let's see if they need anything else. She comes, she's like, we need some more, and then she's like, stay right there, I'm gonna see if we need anything more, and we'll be back. And you started to realize they were taking more pictures than normal. And she's like, I'm just going to take a video of this one. And like her nurse and I could tell they were taking more than normal. And then when they were done, she was like, okay, we're all done. You should be hearing from her doctor today. They don't normally say today.
Oh, really?
And when she said today, I thought that was like a nice little hint of, like, yeah. I don't know. They're not allowed to tell you what they see.
Right.
They can tell you things like, she's like, this is her bladder, this is her uterus, but they can't tell you, oh, I see this. Like, that's not their job.
Yeah.
But they know what they're looking at.
Yeah.
So.
And I've said it many times on this channel. We don't know day by day what kind of complications RAELYNN'S going to have. But look at how strong she is. She's happy.
Oh, and I didn't say why she liked that room. So, the room was dim. She likes, it wasn't like the fluorescent lights, which I don't think she loved in the doctor's offices. The room was dim. They let her stay in her chair, lean back. They were poking on her stomach with that wand, which didn't hurt her. I'm saying too many tangents. There's a TV. There's a TV with cartoons, like, right above her. She could stare at the whole time.
Okay.
So.
You like that?
When they called, they're like, is she hurting? Does her abdomen hurt? I'm like, they were really pushing that wand into her, and she didn't mind at all. You were just like, you're fine.
Did you like that?
Are you in a good mood?
Did you like it?
Talking about the TV. The TV that was on the ceiling when they were looking at your tummy.
Yeah.
You could watch TV the whole time.
She's like, I liked it.
Yeah. You could watch TV the whole time they were looking at your tummy.
And she says, I like that too.
You like your tummy being rubbed?
Yeah, she
Not
liked
having
it.
any pain, huh? No, not having any pain. You're just smiling about it.
Mm-hmm.
You're just smiling. Doop, 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 doop.
Dreaming of you.
You ready to go back to sleep, RAELYNN? You slept almost half the day earlier, but now it's bedtime. Isn't that right? Are you ready to go night-night? Night-night, sweetie.
What if the your smile? What if the wind could spread your love?